The Clinical Management Guidelines, or CMGs, are primarily aimed at independent prescribing optometrists who are working autonomously in a primary care setting. They are designed to support them in making informed, evidence-based decisions on the management of a range of eye conditions. The CMGs were first published by the College in 2008 when optometrists were first granted independent prescribing status following changes in legislation and amendments to the Human Medicines regulations. The Commission on Human Medicines were very clear that these legislative changes had to be underpinned by the provision of published guidance to support optometrists to prescribe safely and effectively within their scope of practice. This was to safeguard patients in settings that may not always be supported by formal clinical governance structures, and the CMGs fulfil this role. The CMGs are written and regularly updated by the CMG writing team using processes that conform to best practice in guideline development. The first step includes searching appropriate electronic bibliographic databases in a systematic fashion for suitable peer-reviewed studies using optimized search terms and filters for a particular eye condition. The next step is to critically appraise these studies using established appraisal tools. The key findings of relevant studies are then translated into clinical recommendations, which are graded to assess the certainty of the evidence and the strength of the recommendation. Finally, the CMG is updated and sent out for peer review. All feedback is considered to refine the drafts before approval and publication on the website, alongside a high-level summary of the key changes to explain those key changes. The CMGs provide the information required for evidence-based practice and are aimed at optometrists who are newly IP qualified and working alone in primary care settings. They're intended to be used alongside professional judgment and patient preference to inform clinical decision-making. We recognise that IP optometrists work in a wide range of settings and have varying levels of scope of practice depending on their skills, qualifications and knowledge. Optometrists can deviate from the CMG recommendations according to local protocols or as they increase their level of experience, provided these are decisions that are clinically justified and in the patient's best interests. For example, we expect most optometrists in secondary care settings and some in primary care settings will become less reliant on the CMGs over time, but they can turn to them for clinical support and reassurance when needed. We know that many optometrists may extend their scope of practice during and after qualifying as an IP optometrist. The College has since published guidance to support our members to advance their scope of practice safely and effectively. This guidance is also cited in relevant sections of certain CMGs where treatment recommendations include options for optometrists that go beyond typical primary care practice. The CMGs are not intended to be a recipe book, nor are they an exhaustive list of the conditions that can be managed by optometrists. The College has expanded the number of CMGs that we publish to cover more eye conditions, but we've also updated them to reflect the changing treatment protocols where evidence is available to support optometrists provide care to patients with more complex needs or at a higher risk level in primary care. We know that the CMGs are not only used by students and optometrists at all stages of the career, but also other health professionals such as GPs, nurses and pharmacists. The CMGs are also cited in other national guidance such as the NICE clinical knowledge summaries. Non-IP optometrists find them very helpful in supporting differential diagnoses and aiding management decisions, as some conditions can be managed without prescription medications as first-line treatment approaches, depending on the clinical presentation. Clinicians tell us that they also find the referral recommendations helpful. These recommendations should be read alongside the College's referral urgency guidance. However, where available, it's also very important to be aware of and follow any local referral protocols.